Hi, this is Dr. Martin, and in this video I'll talk about the skeletal system. This is only the part 1 video, and we will have the second part also. Make sure to watch both. The bones are the organs for the skeletal system. In skeletal system, we do not have only bone tissue, but we have cartilage, that's connective tissue, and blood, nervous tissue as well. The functions of the skeletal system and function of the bones are overlaps because they are the only organs belong to the skeletal system. Bones are alive and multifunctional. That means there is more than one function. First of all, bones support and protect the softer tissue. Example, thoracic cage protects the two vital organs, lungs and heart, as well as the big blood vessels, trachea, esophagus, thymus. We can go on and on. Secondly, bones provide points for attachment to the skeletal muscles. In that way, they aid the movement of the body. Notice they are not starting the movement, or they are not doing the main things to do for movement, but they are only aid to the movement. Thirdly, the bones house, especially the red bone marrow, house the blood producing cells. And fourth, different function, they are store inorganic salts like calcium, phosphorus, magnesium, etc. that we will talk about. Bones are similar in structure, development, and function. However, they greatly vary by size and shape. When we do the classification by shape, we can call long bones if the bone length is higher than their width. So long bones are long and narrow bones. Good example is femur, as shown in this picture, yellow color coded and numerically labeled with the A. They have expanded ends. Beside the femur, we can call the tibia and fibula of the leg, and arm bone, humerus, and forearm bone, radius and ulna, another good example for long bones. Short bones are cube-like, their length and width almost equal. A good example, tarsal bones, which is the short bones, form the ankle, or carpals, they are the short bones that form the wrist. Some authors include the sesamoid or round bones to the short bones as well, but some authors call another section, another classification as a sesamoid bones. And when we look to sesamoid bone, patella, marked with the purple color and labeled with the E, you can see the patella is a sesamoid bone. Sesamoid bone mean they are not just round, but they formed after birth. So when you're born, you don't have patella. By time, they form inside the tendons of the muscles, and they are embedded to the tendons. The flat bones are plate-like broad surfaces. They contain broad surfaces. Good example, skull bones, it's marked with the C and showed as a parietal bone. It's plate-like. And if we can't put any of this classification, then we will call them irregular bones. They have a variety of shapes. Most are connected to other bones. When we look, we can see the thoracic vertebra here and color coded with the green and labeled with the D. Although this is thoracic vertebra, but all the vertebral bones are the irregular bones. Parts of a long bone. We have three regions. One, diaphysis. Diaphysis is the shaft and the long shaft in the middle. An expanded end in the top and bottom we will call proximal and distal epiphysis. And between the epiphysis and diaphysis, we have another section that formed by hyaline cartilage that connects the epiphysis and diaphysis together. We will call metaphysis. So we have three regions: epiphysis in both end, diaphysis in the middle, and between them and the proximal and distal, metaphysis. And when we look, there's a two membranes covers the bone. First membrane is inside, cover the inside of the diaphysis, because there is a hollow chamber inside the diaphysis. We will call this medullary cavity, and adults medullary cavity full with the yellow bone marrow, which is a adipose tissue to provide us energy and storage unit as a storage unit for the adipose tissue. And when we look to the outside the bone, it's covered with another type of membrane we will call periosteum. Periosteum. So we have endosteum, covers the inside of the diaphysis, which is the medullary cavity, and outside of the bone covers all over with the periosteum, except the only part that there is no periosteum are the tip of the epiphysis that make the joint with another bone. For example, in femur, this is a femur shown you in this picture. We have in the proximally head of the femur, and as you see in distally, we have articular cartilage. Articular cartilage, again, hyaline type of cartilage. Now, when we talk about the metaphysis, I said metaphysis has hyaline cartilages. Hyaline cartilages in newborn and young adult, we call them epiphyseal plates. As long as you have hyaline cartilages there, hyaline cartilage cells, the chondrocytes, then that person can grow by length. This about the 25 years old, this is the average age, and you will lose all the hyaline cartilages. When there is no hyaline cartilages, epiphyseal plates will become epiphyseal lines. That means after 25 years old, you are not able to get taller. Only you will get shorter by time, but between 25 and 30 years old, you will have the same length, same height. After 30, it will be downsize, right? We will go downsize by height. Now, when we look, we have the compact bone, which is formed mostly the wall of the diaphysis, and we call cortical or compact bone, and spongy bone or cancellous bone, mostly found in the epiphysis, and they have a honeycomb-like structure. We will call them trabeculae. They are the one contains the red bone marrow. Red bone marrow. We have two types of bone marrow: red bone marrow in the spongy bone, and in medullary cavity we have the yellow bone marrow. When we born, we have more red bone marrow. When we grow up, red bone marrow shrinks and replaced by the yellow bone marrow. Osteoblasts and osteoclasts are the young bone cells. They are movable and they are mostly located periphery of the bone. Osteoblasts are the bone making cells. They deposit the bone. What that means, they take the calcium and phosphorus and inorganic salts from the blood and they deposit into bone. Osteoclasts, the bone resorbing cells. That means they break the bones. They are young cells as well. And osteocytes, however, they are trapped in the lacunae. They are trapped in the lacunae. They are the mature bone cells. They maintain the bone structure. Osteogenic cells are the stem cells. So they are the one that can divide and become the bone cells. When we look under microscope, and we will able to see the mature bone cell, we will call osteocyte. In this picture you can see the osteocyte inside the lacunae. Lacunae are the chambers on the tiny chambers in the bone that contains the osteocytes. Of course, we have tiny canals we call canaliculi. They are the bony structure allows the small capillaries pass through and bring the blood supply to these osteocytes. And as a bone is a compact bone is a connective tissue. As all connective tissue, we have cells and we have the extracellular matrix. And most of the extracellular matrix of the bone made by collagen fibers and inorganic salts. That's why collagen gives the bone resilience and inorganic salts make the bone hard. So we have mostly collagen fibers and inorganic salt. Collagen fibers, the inorganic material, and give the bone the resilience, and inorganic salts make the bone hard. Compact and spongy bone. We have two types of bone tissue, compact bone and spongy bone. Compact bone consists of cylindrical unit called osteons that we will discuss and learn the structure of the osteon. Osteon can be found only in the compact bone, and they are strong and solid and weight bearing and resist the compression. So weight bearing part of the bone is done or formed by compact bone. Spongy bone, however, consists of branching plates called trabeculae. They do not have any osteon, but they have trabeculae structure. This honeycomb of structure allows the nutrient diffuse through inside of it, so blood vessel can get in. Somewhat allows the flexibility of the bone, especially for youngs. So we have compact bone for weight bearing and spongy bone for somewhat flexible and allowing the nutrition diffuse. Compact bone consists of osteons and osteons cemented together to form the compact bone. When we focus on this picture, you see the triangle portion is an enlarged portion from the cross-cut long bone. And let's start from the right side and most outmost part. You see the membrane called periosteum. From the membrane to the honeycomb-like structure, which we will call spongy bone in the medullary cavity, just close to the medullary cavity, you will this long part we will call compact bone. And you will see the cylindrical portion in the compact part we will call osteons. And in the middle of the osteon, you will see the central canal, which allows the blood vessels pass through it. And central canal or Haversian canal is a vertical canal, vertical bony canals that allows the blood vessels and nerves pass through it. We have another canal, it's mostly horizontal or pass through the central canals, we will call perforating canal or Walkman's canal. They are the canals that join adjacent to the central canals. They both have the blood vessels and to allow to provide the nutrition to the bone. So you see, bone is very good in blood supply. That's why when you break a bone, and it heals quicker than a cartilage damage. And when we look at the structure of the osteon, we see the mature bone cells, osteocytes, trapped in the bony chambers, we will call the lacunae, and there's some canals, we will call canaliculi, to capillaries can pass and provide the nutrition supply to the osteocytes. And as you see, osteon has circular layers. We will call these layers of matrix lamellae. And inside the osteon, it looks like a tree-stem kind of like structure we call concentric lamellae. And however, and you will see there is different type of lamellae which covers entire compact bone. We will call circumferential lamellae because it's a circle entire the compact bone. And that is the structure of the compact bone. Parts of the skeletal system begin to develop during the first few weeks of prenatal development. Some bones continue to grow and develop into adulthood. So not all the bones we have as an adult we had or formed before we born or when we born. Bones form when bone tissue replaces existing connective tissue in one of two ways. According to these ways, we can do the classification of the bone either intramembranous bones or endochondral bones. If it is developed between the membranes, we call intramembranous bones, which mostly the flat bones. Or if developed from the hyaline cartilage, then we will call them endochondral bones. Let's go and learn a little bit more. In this picture, you can see the 14-week fetus. It's just a couple of weeks old, and you see some of the bone formed, or you can see the dark red color coded, but some of the bones haven't developed yet. It looks like empty, right? So there's two types of ossification or bone development: intramembranous and endochondral. You see, intramembranous ossification, mostly the flat skull bones are formed between sheets of primitive connective tissue, and we will call intramembranous bones, and long bones and most of the skeleton formed by the hyaline cartilage. We call it endochondral ossification. You can see in this X-ray so much bone because these pinkish ones, pinkish areas that you see between the bones, they are still in the hyaline cartilage form. They are not, the ossification isn't completed yet. So as we said, intramembranous bones originate within the sheet-like layers of connective tissue. They are generally the broad and flat bones. Good example for intramembranous bones, you need to know this: flat bones of the skull, clavicle, sternum, and some fascial bones such as mandible, maxillae, and zygomatic cheekbone. And intramembranous ossification is a process of replacing the embryonic connective tissue to form the intramembranous bone. First of all, mesenchymal cells in primitive tissue differentiate into osteoblasts. So osteoblasts form from the mesenchymal cells. So osteoblasts are the bone-forming cells. They are the young cells. They deposit the bone matrix around themselves. When osteoblasts are completely surrounded by the matrix, they trap in the lacunae. Now they call osteocyte or mature bone cell, so they can only maintain the bone structure. So mesenchyme on outside forms the periosteum. You can see how it's developing, and it shows the frontal bone of a fetus. You can see how the osteoblast formed between the membranes and formed the compact bone on both side and outside, most outside of the bone, and inside we have the honeycomb like the trabecular structure, which is it shows the spongy bone. Endochondral bones begin as masses of hyaline cartilage. Most of the bones in our skeleton done by endochondral ossification. Good example, all the long bones you can say: femur, thigh bone, humerus arm bone, radius and ulnae, which is the forearm bone, Tibia and fibula is the bones found in the leg, and phalanges that found in our fingers, and vertebrae, all the irregular bone, but they are made by endochondral ossification. Endochondral ossification is a process of replacing the hyaline cartilage to form an endochondral bone. Begin as hyaline cartilage model, and cartilage cell we call chondrocyte first gets bigger and large, then lacunae they found inside of it start growing, matrix breaks down and chondrocytes die, and osteoblasts invade the area, start depositing the bone matrix. Osteoblasts form spongy and then compact bone. Once incised by matrix, osteoblasts are become mature bone cell because they trapped in the lacunae. We call them osteocyte. And in this picture, you can see the hyaline cartilage model. Just notice here there is two type ossification center. The first ossification center first formed in the middle of the diaphysis we will call primary ossification center, and notice the secondary ossification centers found in the epiphysis, either proximal or distal epiphysis. And between the epiphysis and diaphysis we have epiphyseal plate. In the metaphysis we call this area metaphysis, and we have epiphyseal plates. As long as you have epiphyseal plate you can grow, and that long bone can get longer, so your height will get longer. Epiphyseal plate closes and returns to be epiphyseal line. That means there is no cartilage cell anymore, and until the 25 years old. So 25 years is the limit. We cannot go taller. And always osteoblast and osteoclast acts, their function is opposed to each other. We will talk a little bit about it later. So that slide compare the major steps in bone development, comparing the intramembranous to endochondral ossification. Growth at the epiphyseal plate. In the growing long bone, diaphysis is separated from epiphysis by the epiphyseal plate, region at which bone grows in length. There is different layers, 4 different zones. Let me talk go about it on the photo. You can see much better. Here we have 4 zones. The most outermost layer, zone of resting cartilage. You see there's scattered cartilage cells and they are small in size. Zone of proliferative cartilage, that means the cartilage cells started to multiplying and there's more cartilage cell form. And the third zone, zone of hypertrophic cartilage, then there is no multiplication, there is no forming another cartilage, but the cartilage cells starting the enlarging, starting getting bigger, right? So hypertrophic cartilage zone is the third zone from the most outmost. The most inner zone in the growth of the epiphyseal plate, we will have the calcified cartilage. When they started calcifying, and lastly they will start forming the ossified bone of the diaphysis. We said osteoblasts and osteoclasts opposed to each other by their function, because osteoclasts break down the calcified matrix and osteoblasts invade and replace the cartilage with bone tissue. Bone can continue to grow in length as long as you have chondrocyte or cartilage cells of epiphyseal plate that remain active. When ossification centers meet, an epiphyseal plate ossifies, bone can no longer grow in length. Bone can thicken, however, by depositing the compact bone on outside under the periosteum. So when you break a bone, generally you repair through this channel, like under the periosteum. You have still osteoblasts, and the osteoblasts will help you to repair your bone fracture. And here you have seen age of ossification of the bones. You don't need to memorize those. We use these charts to determine the person's age. For example, if you have a body and you're trying to determine, and forensic medicine doctor trying to determine which age the skeleton belong, that's the chart they can use. Or in other subjects, and if you have a child, a living child or living person, but you don't know the age and they don't know their age when they're born, then especially underdeveloped countries, and you can use this chart to detect their biological age. For example, when we look, what we do as a doctor, when I worked, I was sending the people comes for age determination to the X-ray, and they were taking the X-ray of their wrist, so I can count the formation of the bone, so I can determine the age. When you look to 15 to 18 years of females, you will see the bones of the upper limbs and scapula completely ossified. So if they are completely ossified, you can tell that this kid cannot be, if it's female, cannot be younger than 15, or cannot be younger than 17 if it is male. So those are the criteria that determine roughly the age. Homeostasis of bone tissue. So bone remodeling occurs throughout the life, and that is the opposing process of deposition by osteoblast and resorption by osteoclast. They occur on the surfaces of endosteum and mostly the periosteum. So bone resorption is the removal of bone. It's the action of the osteoclast. Bone deposition, formation of the bone, action of osteoblasts. 10 to 20% of our skeleton is replaced each year. Factors affect the bone development, growth, and repair. Nutrition, sunlight exposure, hormone levels, physical exercise, they all affect the bone development, growth, and repair. Vitamin A, C, and D has an effect on bone development. Vitamin D has a role in calcium absorption. If the person doesn't have enough vitamin D intake, deficiency causes rickets and osteomalacia. Rickets is a disease caused when the person has vitamin D deficiency when they are children, and osteomalacia happens in adults. Vitamin A affect the osteoblast and osteoclast activity. If we don't have enough vitamin A, deficiency retard the bone development. So you can have a 10 years old, but it look like a 5 years old has a bone development because of the vitamin A deficiency. Vitamin C, however, has role on collagen synthesis. So deficiency of vitamin C results in slender, fragile bones. This is more important because think about for the elderly. Think about the vitamin C you can find in which foods, and generally the oranges and yellow color coded vegetables, right? And when you notice the elderly doesn't eat the fresh food because of either their teeth is not good enough or they cannot go shop and cook, they mostly eat the canned food. So that's why if you are taking care of an elderly people, make sure they have enough vitamin C replacement so they can have a stronger bone, not the fragile bones. The hormones. growth hormone, thyroid hormone, parathyroid hormone, sex hormones, they all affect the development and growth and repair. Growth hormone stimulates the cartilage cell division. So if there is not enough growth hormone, if there's insufficiency or excess, it will cause some diseases. If there's insufficiency in a child, it will result with the pituitary dwarfism, and that means they will be very short, but all part of their body will be proportional. It will be like a smaller size of the adult. And if they have excessive growth hormone, it will cause two type of disease. If it is in child, if there's a excessive growth hormone when the person is a child, we will call gigantism. It will be gigantic. When it will be tall, very, very tall. And acromegaly, however, is the disease that happen in adult. And I will gonna show you the pictures. Thyroid hormone causes the replacement of cartilage with bone in epiphyseal plate, and because they increase the osteoblast activity. Parathyroid hormone stimulates the osteoclast, that means break the bone, because parathyroid hormone try to increase the calcium in the blood. So how they can do it? They need to break, the bone needs to be broken and calcium taken from bone and put into the blood. Sex hormones like estrogen and progesterone, estrogen and testosterone promote the bone formation. They stimulate the ossification of epiphyseal plates. That's why in the boys, for example, they don't get taller until they hit the puberty. After puberty, when their testosterone released, and you will see the boys will get taller than the girls because they have the effect of the testosterone. And physical stress stimulates the bone growth, and we know that there is some exercises or look at the athletes, the basketball player or swimmer generally tall, however the gymnast that the gymnastic movement or the heavyweight lifter, generally speaking, they are shorter and stunned and strong but short and stunned. So physical stress affects the stimulation of the bone growth in a different way, of course. Now look at the growth hormone. That is a good example. Gigantism shown in the left side. The picture on the left side, you see the normal person, but the gigantic person is almost like a 50% taller than the normal person. Acromegaly. A good example for acromegaly, Andre the Giant. And if you watch the Princess Bride movie, you know who it is. You see how big. And acromegaly, because they cannot get taller, they go, or their bones get wider. Look how the picture, there's a 4 picture, black and white picture. You see, this is belongs to one person. Look how handsome in the beginning, and when you go to the last picture, in a very short time, you can see how the facial structures becomes rough. Okay, now we came to clinical application, the fractures. Fractures are classified by cause, what caused it, and nature of the break. And it can be either simple or compound. Or in other words, it can be closed or open. If it's closed, that means fracture protected by uninjured skin or mucous membrane. So bone is not exposed to atmospheric air. But compound or open fracture, bone is exposed to the outside through an opening in the skin or mucous membranes. Compound fracture are more dangerous because they can get infected easily, so they are emergency, they need to be treated emergently. But closed fracture, as long as there is no blood vessels or nerve injury, they can wait to be repaired. Type of fractures, we see the green stick fracture. in the first picture on the left top, and it's an incomplete, right? There's break occurred, but not completely bone is separated from each other. It generally happens in the children. And a fissured fracture is an incomplete longitudinal fissure, and it generally happens in the metatarsals, especially the avid runners may have this type of fracture fissure. And comminuted fracture is complete and fragments the bone, and that happens either by a huge impact trauma or gunshot. You see, the transverse fracture is complete. The break occurs in the right angle to the axis of the bone. An oblique fracture occurs at the angle other than the right angle to the axis of the bone. And the spiral fracture is caused by excessive twisting of a bone. Now, in those all type of fracture that I showed the picture to you, the one fracture that you need to be careful when you're evaluating is this spiral fracture, because spiral fracture requires at least two different movements, right? Twisting of the bone. I am not saying all the spiral fracture is the sign for the child abuse or elderly abuse, but you need to keep in mind that might be the one of the reason the spiral fracture is happening. Now, let's discuss the steps in fracture repair. The first, hematoma. Hematoma meaning large blood clot. And that is the first step. The second, cartilaginous callus, and is shown in this picture to you. Please follow through the pictures. You will see the B shows the cartilaginous callus on the right upper corner. And it is during the cartilaginous callus, phagocytes remove the debris, and fibrocartilage invades and start creating the collagen fiber. And bony callus section, and which is the third stage, and osteoblasts invade the area and start filling with the calcium and depositing calcium and phosphor and fill this space. And the remodeling, bone restored close to the original shape, and as you see, osteoclast comes and trim the excessive bone production. So let's repeat the bone function one more time. They provide the shape to body, they support and protect the body structures, and they aid to body movements. They contain tissue that produces the blood cells, and they store the inorganic salts. So bones, we said, provide shape for the head, face, thorax, limbs. Bones support the body weight. Bones of the lower limbs, pelvis, and vertebral column, and they are the mostly the one support the body weight. Skull bones protect the brain, eyes, ears. Bones of rib cage or thoracic cage, shoulder girdle protect the heart and lung vital organs. Bones of the pelvic girdle protect the internal reproductive organs, lower abdominal organs. Bones and muscles together provide the movement, but the movement actually provided by muscles. Bones aids the muscles to shorten and relax and allow the movement. Now there's a word, hematopoiesis, that means blood cell formation. Blood cell formation happen in the red bone marrow because red blood cell, white blood cell, and platelet stem cells found in the hosted in the red bone marrow. By age, some bone marrow replaced by the yellow bone marrow, and yellow bone marrow is the storage for the fat or triglyceride, and they do not produce blood cells. Inorganic salt storage, about 70% of the bone matrix consists of inorganic mineral salts, and most abundant salt is a crystal of hydroxyapatite or calcium phosphate. So calcium phosphate is the most abundant salt. And there is, however, other salts such as magnesium, sodium, potassium, and carbonate ions. And we have a disease called osteoporosis. It's a condition that results from loss of the bone mineralization. So basically, bone mineralization loss, we will call this disease osteoporosis. And I will show you a little bit more pictures related with osteoporosis because it's a very common disease, especially in elderly. Since calcium is vital in nerve impulse conduction and muscle contraction, blood calcium level is important to be regulated, and we have two hormones for this: parathyroid hormone released from parathyroid glands and calcitonin released from the thyroid gland. Let's see that. Calcitonin, so if we have so much blood calcium level in our blood, that is not good either, so we need to decrease it. What will gonna happen? And if there is an increase in calcium, and the calcitonin will release from thyroid gland, and they will allow the deposition in calcium deposition into the bone. Do you remember which bone cell responsible to deposit the bone? We know the osteoblast. So that's why calcitonin has an effect on the osteoblast. So osteoblast can do the deposition into the bone. And how they do that? Because they do not only deposit the bone calcium into bone, because the main reason to decrease the blood calcium level because it's so high. And what else they do? They decrease the calcium uptake in intestine. They say just lose it, right, through the goiter, and they have the effect on the kidney. They say do not hold, do not reabsorb the calcium back, let it lose by urine. So that is the effect of the calcitonin. So if calcium level so high, calcitonin is released. However, if calcium level is too low, then parathyroid glands, you see that the 4 glands on the thyroid gland, 4 tiny glands is attached to posterior portion of the thyroid gland, and they release the parathyroid hormone if there is less calcium in the blood. And now if you don't have enough calcium in the blood, where you will gonna go? You will go to storage unit, right? And bone. So they activate the osteoclast. They activate the osteoclast. Parathyroid hormone activate the osteoclast. They increase the calcium release from the bones, and they have an effect on the small intestine. They increase the calcium absorption from nutrition, and they increase the calcium reabsorption from the kidney, so you will not lose via urine as well. So that's the hormonal control of blood calcium level. So they will get the normal according to this hormonal control. Fragility fracture. Fracture that occurs, fracture meaning broken bone, right? Fracture that occurs from less than standing height, a sign of low bone density. Bone remodeling occurs throughout the life, but with age, osteoclasts remove more bone tissue than osteoblasts can able to deposit it. And then that result osteopenia, that means bone loss, bone cell loss, and that progress to osteoporosis, which is the severe bone loss that leaves the spaces and canals in bone and weakens them. And estimated that half of the people over 50 have one of the bone loss condition, common in postmenopausal women due to hormone changes because there is no enough estrogen anymore. So to prevent the fragility fracture, we need to get 30 minutes of exercise per day, and we should include the weight bearing exercises. We need to get enough calcium and vitamin D, and do not smoke because smoking affects the estrogen hormone, and via this and increase the bone fracture. So I wanted to give you an example about osteoporosis. Osteoporosis literally means the porous bone. It's a disease in which the density and quality of bone are reduced. Mineralization is what? Reduced. As bones become more porous and fragile, the risk of fracture is greatly increased. The loss of bone occurs silently and progressively. That means you don't even notice until you have a broken bone. What happens when we get older? So you height decrease, that begins in the age of 30 and continues to the end of your life. Calcium levels fall, bones become brittle, more prone to fracture. Osteoclast outnumber the osteoblast. Spongy bone weakens before the compact bone. Bone loss rapid in menopausal women because the estrogen protection is gone. And hip fractures is the common one. And vertebral compression fractures should not be avoided. And as you see in this picture, red arrow shows the vertebral compression. I hope you like it. Have a good day.